Hello, can we see it all?
Yes, we can.
All right, great. Well, welcome everyone. And thank you, Zoe and Suzanne, for those wonderful introductions and just appreciate being here and getting to share this study and these results with everyone. So this presentation is on test-retest reliability of the EASI with preliminary results. Uh, and I want to give contributions to Patricia Grady, who completed the statistical analysis, and my wonderful mentor in this project, Dr. Zoe Mayo. So to get us started, I thought it would be helpful to just kind of situate ourselves in thinking about those important steps in developing an assessment. And it sounds like many of us on this have been a part of developing the EASI or helping and assisting in different ways. And so, it's important with any new assessment to really look at the psychometric properties. And those psychometric properties can include validity. Does the measure test what it's meant to measure? Reliability, is the measure consistent? And then responsivity looks at that sensitivity of a measure. Today, I'm focusing on one of the components of reliability, named that test-retest reliability. So why might this be important, specifically that test-retest reliability? Well, if you're a clinician, this helps to give you confidence that your scores are accurately reflecting the child's performance. As a researcher, it's important to utilize standardized, really strong assessments within your research studies. And I even did a little bit more research on my own of the international component, and it was identified that the Cosmin checklist looks at different measurement properties, and the test-retest is one of the components that they look at for a really strong instrument and measurement. So those are some of the reasons why test-retest reliability are important. So we'll jump right into the study design and procedure. And in some cases, some people might think this part is a little bit boring, but just as Zoe had talked about, I'm always interested in thinking of ways that we can do research really in a feasible way, in a way that allows us to work together within groups and collaboratively. So I hope as I provide the study design and procedure, that's what you can also think about is, is this how could you be a part of research studies in the future? Could you lead one? Could you collaborate with others and so forth? So of course, we're going to start with the EASI because the EASI was the test that was used. And as many of us are very familiar with it, there are a total of 20 tests on the EASI. However, during this time period when I was starting to do the test at that point, I included 18 of the 20 tests. So you'll notice 2 that are not on here are the sensory reactivity and then the proprioception force. All of the other tests, though, were tests that were included in this study. As we started the study, of course, I received IRB approval from, at that time, it was both Thomas Jefferson University and St. Ambrose University, which is where I work at. And after receiving IRB approval, I luckily have a number of students who are really interested in learning more about sensory integration and learning more about assessments of sensory functions. And so those students they were able to participate in this research study. I trained them on 4 EASI tests. So I had 5 students that I trained each student with 4 of the tests. And they were trained very extensively. They watched videos, they demonstrated in front of me, they did some competency checkouts, and I examined scoring. So I really ensured that they knew those 4 tests really well and that they would score them accurately. However, in saying that, given that we did this study with 5 students, we did not have an extra person to be able to complete the vestibular nystagmus test in the recommended way. And so what we had done is we had the child participate in the vestibular nystagmus test where they sat on the board themselves and we rotated it. However, we didn't have an additional person to hold the child's head in place. And so I wanted to identify that one component. All other 17 of the 18 tests were completed within that recommended standardized procedure. Okay, and then the students completed that competency checkout. While that was occurring, while students were learning more about the EASI test and that administration and competency, we were recruiting children at that same time so that we could start hearing of children that would want to participate in this. And so our inclusion criteria is that we included any child between 3 years, 0 months to 12 years, 11 months that reported that they were typically developing. So the caregiver had to report that there was no known diagnosis, educational or medical diagnosis. And then for the parents, they signed a consent form. And then for children that were 7 years and older, they signed an ASENT form that they would be willing to participate and help us. The children were recruited through a convenient sample, so word of mouth. We also had we have a daycare center that is right across the street from us. And so we were able to collaborate with the daycare center and ask parents there if they would want their child to participate in this study. So we were able to really be able to test children at a daycare center as well as at our campus at St. Ambrose. So what does testing look like with test retest? Well, essentially what you're trying to do is you're trying to complete the test in one session, and then there's this 10 to 14 day interval waiting time, and then you test the child again in a second time period. It's really important to keep it close together, but yet that it's not too close. So those days are strategically in place because of past studies help to inform us of that 10 to 14 day period. What we were able to do, and when talking with the caregivers that were bringing the children to St. Ambrose, or if we were going into the daycare, we did this 2 different ways. And that children that were coming to St. Ambrose and they had to utilize transportation to come in, they typically chose to do all 18 tests within one sitting. And so they would do those 18 tests. We waited the 10 to 14 days and then did the 18 tests in another one-time sitting. For children at the daycare center, they're younger children, and we needed to complete the testing around their schedules and also just with their abilities. And so for those children, they completed 9 tests, and then they completed another 9 tests within 1 week time period. So they had 2 different testing sessions. We then waited the exact 10 to 14 days from each one of those testing sessions, and then they completed the test again in the 2 different sessions. So we kept very systematic in that process. And each examiner was the exact same examiner that tested them the first time, that tested them again the second time. Of course, all of the data then was entered on paper and then entered into the EASI scoring program. And what that allowed for is it allowed for us ultimately to extract the data in a de-identified way. And so therefore, we could then look at it and analyze it. We started this study in 2019, but we started, and of course, 2019, right around that time, we were able to get a limited number of children to participate. And also, given the nuances of the students that were participating, they are also on a time parameter of their academic year. And so what we did is went ahead and completed this exact same process 3 different years in a row. And so this occurred across 3 years. I shouldn't say in a row because 2020 obviously was changed. So it was 3 different years that we completed these exact same steps. All right, so here are the results. We had a total of 28 children that participated in this study. 43% were males, 57% females. And then you'll see here the age distribution from the 3-year-olds to the 12-year-olds. And so on the left is that age or the age, and then on the right is the number of children within each age that participated. And what I also have here on the right-hand side is the interclass correlation coefficient interpretation that then we used to examine the results. So this ICC 3-1 two-way mixed effect model was used This really places that examiner as that fixed factor, because as you remember, I said that the examiner was the same each time. And so this is really suitable for that intra-rater test retest studies. And I'll show the results for each test on the next slide, but you'll notice here that I have the different intervals. So excellent is at the top, above that 0.90. Good is between 0.75 to 0.9. Moderate is 0.5 to 0.75. And then poor is anything below that 0.50. All right. So I know this slide is a little bit busy, but I did want to put all of the tests on here and their results. So I have categorized them just as the same way as what you saw previously, in that we have the test identified on the left-hand side. You'll see the sample size of the number of children that ended up participating in those exact tests, and then their interclass correlation coefficient, the p-value, and then the interpretation from that. And so as you're looking through it, I'll also give you just a little bit of a summary. So we had a total of 2 excellent tests, 12 really good tests for test retest reliability, 4 that had met that moderate, and then 1 that was considered poor. So I think the really key finding is that 14 of the 18 EASI tests demonstrated good to excellent test retest reliability. The one poor was that vestibular nystagmus test. And I think it's important to note, and that's why I kind of talked about it before, we did not have that ability to be able to hold the child's head in place while they were rotating. And so that could have been one reason why those results were a little bit lower scored. So right now, from this study, what we know is that we can prioritize that same examiner. We'll see that we have very reliable results with most of the test. In general, this is a very reliable assessment tool, and it certainly is going to support meeting that need for the test retest reliability. And of course, with any study, though, I want to make sure I identify, some of the study limitations, but then of course that will lend us to future opportunities. But the study limitations being that it is still a small sample size, so these are preliminary results. There is another colleague that is working with this test retest, and so we're hoping to add her sample as well to this to increase the sample size. And you'll notice on the sample of those individual tests that they might not have all had 28 children participate. Sometimes it was 21 or 15. And that was because of the nuances. For example, when we went to the daycare center, and while we were able to get testing session 1 completed, when we went back for testing 2, unfortunately, there was a day that the daycare had closed. And so those are some of the situations that we can't really predict going to happen. And so that did impact some of those numbers, that not all 28 participated, and that was the reason why. As we look to future research studies, though, we can look to really expanding the sample size. I could see replicating this study, not just nationally here in the United States, but really internationally, the study could be replicated and published. And so I think there's just a lot of opportunities with this beginning work. Of course, I want to thank, all the children and families that participated in this study and are helping us to really learn a lot more about how to test children and how to make sure that we have a reliable and consistent measurement to use. Here's my references.
Thank you, Jenny.
Yeah.
All right, very nice. That's a lot of testing. That's a lot of hours of testing. A lot of children. I know you felt like your sample size was small, but that's 56 times the hours of testing. So well done. Well done. Nice to see it came out so well.
Yes.
Zoe, do you have anything to add, or we're good?
I just think, I think you have somewhat similar findings to what we saw with the SIP, that some of the basic sensory areas just tend to be less stable functions. And so on the SIP, also the nystagmus test and the tactile test were less consistent across time. Something I think that, as clinicians, testers, we want to keep that in mind, that we always want to look at we don't want to look at test scores in isolation. We want to look at the functional issues, see if when we have a group of test scores, if they help us to feel more or less confident about the results. I mean, we could probably go on and on, but just for now, those are a couple comments.
All right, and I think I misspoke earlier. I think I said inter-rater, and of course we'd love to have that data too. But let's go on. Berta, do you want to present your study?
Berta,
Perfect.
tienes.
Perfecto. Bueno, voy a hablar en español, ¿vale? Isabel está aquí conmigo, acompañándome. Y lo primero que quiero dar es las gracias por esta oportunidad de presentar este estudio de investigación en este webinar, en el que tengo el placer de compartir tanto con la doctora Isabelle Beaudry como con la doctora Schaaf, y que recientemente ha dado lugar a una publicación en la American Journal of Occupational Therapy.
And so I'll be translating for Bert. Thank you for having us. We'll be sharing the results of this study. We're so happy to have had the opportunity to work with Dr. Roseann Schaaf on this. And it was just published in AJOT a few weeks ago. So we're so happy to share this with you.
Aquí tenéis el artículo. Hoy queremos hablar de un concepto que probablemente todos los terapeutas ocupacionales utilizamos con frecuencia, que es esa búsqueda sensorial, ese sensory seeking, y aunque es un término muy utilizado tanto en la práctica clínica como en la literatura científica, cuando intentamos definir qué significa o qué engloba, nos encontramos en muchas ocasiones con más preguntas que respuestas.
So today we want to be talking about sensory seeking, which is something that many occupational therapists talk about. But when it's time to define it and really, try to understand what does it actually mean, what does it actually, imply, that's not so easy. We have like more questions than answers, actually.
Y para entender este concepto necesitamos englobarlo dentro de la teoría de la integración sensorial de Ayres. Como todos sabemos, dentro de la teoría de integración sensorial de Ayres incluye dentro de los problemas de procesamiento sensorial la reactividad sensorial, y dentro de la reactividad sensorial incluimos hiper e hiporreactividad, originariamente denominadas hiper e hiporrespuesta.
So we have really anchored our study in Ayres Sensory Integration. And as you all know, within the different patterns, we have the pattern of reactivity with the hyper and hyporeactivity, also previously known as hyper response or hypo response.
Y la relevancia de la reactividad sensorial es tal y ha sido ampliamente estudiada que incluso en el DSM-5 se ha incluido como criterio diagnóstico dentro del trastorno del espectro autista, en el que hablan de hiper e hiporreactividad sensorial o interés inusual en aspectos sensoriales del entorno dentro del criterio patrones repetitivos y restringidos de conductas, actividades e intereses.
So as you all know, the reactivity pattern has gotten a lot of attention, and in the most recent version of the DSM-5, it's actually included as part of the autism diagnostic criteria. And so we do have those hypo responses and unusual interests in sensory features. So it's something that has been really discussed as part of autism.
Siguiendo el trabajo de la doctora Ayres, la doctora Dan desarrolló un modelo teórico en el que incluye 4 patrones de procesamiento sensorial, y dentro de esos 4 patrones aparece la búsqueda sensorial.
So following the work of Ayres, others have looked at reactivity. Dr. Dunn looked at this, and in her theoretical model of sensory processing, she included 4 different patterns of reactivity, where she includes sensory seeking as one of those patterns.
Y lo que dice la doctora Dan es que esta búsqueda sensorial está enmarcada dentro de umbrales sensoriales altos y que las personas con búsqueda sensorial buscan de forma activa estos sistemas sensoriales, estos estímulos sensoriales que necesitan, puesto que necesitan más intensidad a la hora de captarlos.
So according to Dunn's model, sensory seeking would be linked to a high sensory threshold, which would mean that people would need more intense sensory input. And that's where this active sensory seeking would come from.
Pero también la doctora Dan habla del patrón de bajo registro que se enmarca dentro de esos umbrales sensoriales altos, al igual que la búsqueda sensorial, con la diferencia de que estas personas, las respuestas son más pasivas frente al buscador sensorial, que tienen estas respuestas de búsqueda más activa.
Dr. Dunn also includes low registration as one of her patterns, another pattern that would be theoretically linked to high sensory thresholds. But in this pattern, it's more of a passive strategy. There is no active seeking.
Y esto nos plantea una pregunta interesante. Si ambos patrones sensoriales comparten umbrales altos, ¿hasta qué punto están realmente relacionados entre sí?
So the question is, if both of these patterns, sensory seeking and low registration, are theoretically linked to high sensory thresholds, what is the relationship? We're expecting a relationship between these two patterns.
Y cuando hablamos de búsqueda sensorial en personas con desarrollo típico, lo que lo que nos dice la literatura es que hay una preferencia por estímulos nuevos, estímulos intensos y altos niveles de estimulación. Y además, lo que nos dice la evidencia científica es que es una estrategia compensatoria para llegar a un estado óptimo de alerta.
Entonces, when we try to define sensory seeking and we see what the literature has to say in typically developing people, it's really a preference for novel and intense experiences, high levels of stimulation, and it's often also described as a compensatory strategy to maintain optimal arousal.
Y en adultos, además, se ha relacionado con aspectos más emocionales como es la depresión o la resiliencia, y además se ha asociado con la autorregulación, la atención, la flexibilidad de comportamientos y cómo esto impacta en la participación de las actividades de la vida diaria.
In adults, it's also discussed in relationship to emotional outcomes such as depressive symptoms or resilience. And also it's been associated with challenges in self-regulation, attention, shifting, and behavioral flexibility. And it does have an impact also on participation in daily activities.
Y en conjunto, toda esta evidencia nos lleva a una conclusión importante, que es que la búsqueda sensorial podría ser multifactorial.
So overall, sensory seeking may be multifactorial in nature.
Entonces, nuestro estudio realmente no pretende dar respuesta a todas estas explicaciones, sino que nuestro estudio se centra en algo más concreto, que es analizar si hay una correlación entre búsqueda sensorial y bajo registro, puesto que son esos dos patrones que el modelo de Dan indica con umbrales sensoriales altos.
So we know that we couldn't answer all of these questions, but we were trying to see if there would be a relationship between sensory seeking and low registration, as both are theoretically linked to these high thresholds that would be the basis of both of these patterns.
Y responder a esta pregunta es muy importante a nivel clínico porque pueden tener implicaciones directas en nuestra práctica clínica diaria.
And trying to clarify this is very important for our clinical practice because we have to, really understand what this behavior can actually represent clinically for us.
Dentro del autismo, dentro de los estudios de investigación que se incluyen en autismo, los estudios de Banarek nos ha indicado y nos muestran que esta búsqueda sensorial puede darse también en esta población por regulación sensorial, como por altos niveles de comportamientos repetitivos, cambios en la atención, problemas en la parte más de participación social. E incluso estos estudios nos hablan que pueden ser estrategias compensatorias derivadas de ese bajo registro, pero también de otras cosas, como puede ser pobre percepción sensorial o baja percepción sensorial, así como problemas de praxis.
So the sensory seeking described in autism is quite varied. We have, things that have been linked, have linked sensory seeking to self-regulation strategies that are linked to high levels of repetitive behavior, greater challenges in attention and social engagement, but it's also described as a strategy to compensate for low registration or poor sensory perception and praxis.
Entonces tenemos múltiples factores que puedan estar relacionados con esta búsqueda sensorial y tanto la doctora Lane, la doctora Schaaf, la doctora Bandy ya han hablado de esto en otras ocasiones y en el modelo teórico de la doctora Lane y la doctora Bandy más reciente vemos cómo ellas relacionan esta búsqueda sensorial con reactividad, percepción y praxis, ¿no? Entonces vamos a ver. Nosotros queremos ver qué pasa con esta correlación entre bajo registro y búsqueda sensorial dentro del modelo de edad para ver si hay esa correlación.
The literature is quite clear. Lane and Schaaf, Bundy and Lane more recently really describe sensory seeking as being linked to multiple factors. Hyporeactivity, compensation strategies to maintain arousal, perception issues, praxis issues could all possibly be linked to this sensory seeking. But we really set out to find out if there was this expected relationship between low registration and sensory seeking as described in the Dunn's model.
Entonces, para ello lo que hemos realizado es analizar una muestra de 787 personas adolescentes y adultas españolas con desarrollo típico.
So our participants were healthy, typically developing adolescents and adults in Spain, and this was a big group, 787 people.
Y como criterios de inclusión y de exclusión, como criterios de inclusión hemos incluido personas mayores de 11 años de edad, con residencia y nacionalidad en España y que han completado el Adolescent Adult Sensory Profile, que es la herramienta que hemos utilizado. Y como criterio de exclusión, cualquier persona que tenga un diagnóstico clínico que pueda impactar la parte de procesamiento sensorial o que esté tomando algún tipo de medicación que pueda impactar en el sistema nervioso.
So really, all adolescents 11 years or older living in Spain that were able to respond to the entire questionnaire and did not have any kind of neurodevelopmental condition or were taking any medication that could impact their arousal. Those were our exclusion criteria.
Y la realidad es que hemos obtenido una muestra muy, muy rica y muy equilibrada, tanto en género, en hombres y mujeres, tanto en grupo de edad como en la participación a nivel nacional. Tenemos una muestra muy rica en diferentes puntos del ámbito nacional.
So our group was quite balanced in terms of males and females in different age groups, and also was representative of all of Spain.
¿Qué instrumento hemos utilizado? Bueno, el Adolescent Adult Sensory Profile, que es una herramienta un cuestionario de evaluación que está adaptado culturalmente a España. Y este cuestionario consta de 60 ítems y cada ítem se relaciona con una modalidad sensorial que, a pesar de que el cuestionario no da puntuaciones por modalidades sensoriales, sí que se relaciona con una modalidad sensorial y también se relaciona cada ítem con un patrón sensorial, bajo registro, búsqueda sensorial o evitación sensorial o sensibilidad sensorial.
So we used the Spanish version, a cultural adaptation of the adolescent sensory profile, has 60 questions across sensory systems, and although it does not give scores by sensory systems, it does ask about all the different sensory systems, but then answers are placed into categories of sensory seeking, low registration, sensory avoiding, or sensory sensitivity.
Y lo que hemos realizado es un análisis de Pearson con el total de la muestra, con las 787 personas en total, y además hemos analizado este análisis por grupos, tanto por adolescentes como por adultos mayores de 65 años.
So what we did was look at the correlations between the patterns for the entire sample, but also by age group.
¿Y qué resultados hemos obtenido? Hemos obtenido unos resultados que indican que con nuestra muestra, esta muestra de 787 personas con desarrollo típico, no se ha encontrado una relación entre bajo registro y búsqueda sensorial. Y además tampoco hemos encontrado relación entre búsqueda sensorial con otros patrones que incluye el modelo de Dan, como puede ser sensibilidad sensorial o evitación sensorial. Por otro lado, sí que hemos encontrado una correlación entre bajo registro, sensibilidad sensorial, y bajo registro, evitación sensorial. Y la correlación más fuerte la hemos obtenido entre sensibilidad sensorial y evitación de estímulo sensorial.
So the expected correlation between sensory seeking and low registration was not found. So we were thinking that since both of these patterns were theoretically linked to this idea of a high threshold, that we would expect a correlation, but we did not find this correlation. What we did find was a correlation with sensory sensitivity, which was somewhat surprising. And we did find the expected correlation between sensory sensitivity and sensory avoidance.
Entonces, nuestro estudio contribuye al debate actual sobre los mecanismos subyacentes de esta búsqueda sensorial, de esta conducta de búsqueda sensorial, utilizando una muestra de adolescentes y adultos con desarrollo típico en España.
So we did not find the expected correlation, but we did have a nice big sample, and we're able to really look at this in adolescents and adults in Spain.
Y a pesar de que hay una relación propuesta entre esa búsqueda sensorial y ese bajo registro, ambos con umbrales sensoriales altos, nosotros no hemos obtenido esa correlación significativa. Sin embargo, este mismo resultado también había sido determinado por otros estudios de investigación que además obtienen resultados similares a los que nosotros hemos encontrado y sí obtienen esa correlación entre bajo registro con sensibilidad sensorial y evitación sensorial y encuentran esa correlación fuerte entre sensibilidad sensorial y evitación sensorial.
So, as we said, we did not find a significant relationship between sensory seeking and low registration. Both of these patterns, theoretically linked to this high threshold. We did find, as others have found also, that low registration was related to sensory sensitivity and sensory avoiding, and there was a strong association with sensory sensitivity and sensory avoidance.
Y estos hallazgos sugieren que la búsqueda sensorial podría no ser una única consecuencia directa a umbrales sensoriales altos, tal y como había indicado la doctora Dan, sino más bien un fenómeno conductual complejo derivado de diferentes multifactorial, ¿no?
So this sensory seeking is much more complex than simply a manifestation of low registration. It seems more likely that it's multifactorial, complex behavior related to many different underlying factors.
Cuando analizamos la parte de esa correlación por grupos de edad, los resultados son más o menos similares a los que hemos encontrado en la totalidad de la muestra. Sin embargo, sí que encontramos una correlación pequeñita entre búsqueda sensorial y bajo registro en el grupo de adolescentes.
When we looked at this by age group, the results were similar. We did find a weak association between sensory seeking and low registration in adolescents.
Y esta diferencia, esta correlación nos indica que puede haber un cambio de procesamiento sensorial en relación a la edad, ¿no? Incluso cuando analizamos el estudio de Ángel Jäger y Rose Blum del año 2021, en su muestra el 25% de las personas con desarrollo típico mayores de 65 años tienen menos comportamientos de búsqueda sensorial y esto puede impactar en esa interacción con el entorno y esa participación en actividades de la vida diaria y de la ocupación.
So it seems there's like an age trend with sensory seeking. Studies looking at typically developing adults older than 65 did show a tendency for less active seeking, which may have an impact on their participation in their daily activities.
Por tanto, no podemos atribuir únicamente la búsqueda sensorial con umbrales sensoriales altos o a bajo registro, sino que tenemos que ir más allá y tenemos que pensar que puede derivar de otros factores, como puede ser la regulación, la personalidad, e incluso la propia doctora Dan habla de que puede haber una relación con el temperamento dentro de esa búsqueda sensorial.
So sensory seeking really can't be attributed to only sensory thresholds or this idea of low registration. We have to consider self-regulation, personality, and even temperament as a trait to explain some of this sensory seeking.
Y también como terapeutas ocupacionales tenemos que considerar y analizar en nuestras evaluaciones clínicas a las diferentes personas que tenemos en clínica esa parte de reactividad sensorial, percepción sensorial, praxis o otras en el momento que vemos comportamientos de búsqueda sensorial y no quedarnos únicamente con que es un umbral sensorial alto o que puede estar vinculado a ese bajo registro.
So really, as OTs, using the sensory integration approach, we have to do comprehensive assessment, which includes sensory activity, but also, of course, sensory perception, praxis, and consideration of other factors to really try to understand what is going on and could possibly be the underlying factors linked to this sensory seeking behavior.
Y esto es una futura línea de investigación, igual que una futura línea de investigación sería entender mejor esa evolución de procesamiento sensorial en función de los diferentes grupos de edad o del ciclo vital.
So obviously future research is going to be looking at this sensory seeking behavior related to all of the other sensory constructs. And also we're looking to understand age-related changes. How does this develop and change over time?
Y como conclusión a estos resultados, indicar que, bueno, que solamente esa idea de que esa búsqueda sensorial deriva de un umbral sensorial alto, de un bajo registro, tenemos que analizarla mejor como clínicos y como investigadores. Y estos resultados siguen un poco la idea de esa doble dimensión de reactividad sensorial de hipo e hiperreactividad. Esa hiporreactividad más ligada a lo que la doctora Dan en su modelo indica como bajo registro y esa hiperreactividad relacionada con la sensibilidad y evitación sensorial. Por eso necesitamos estudios futuros que analicen un poquito más en detalle esto.
So obviously these results call into question, the idea that sensory seeking is a sensory reactivity pattern, linked to poor sensory registration. We have to go beyond that idea. We also think that this might be more supportive of the idea of the two-dimensional model, the hyporeactivity, which we refer to in Ayres Sensory Integration, could be equivalent or described as low registration in Dunn's model. And what we describe as hyperreactivity would be this sensitivity and avoidance patterns in the Dunn's model, which we found a very strong correlation in those two patterns.
So, thank you.
Thank you.
That was so great, both of you guys, and thank you, Isabelle, for that beautiful translation. Well, I loved reading this story. I felt like validated for so many years. I just thought sensory seeking doesn't belong in there. And having worked with the blind population for many, many years, I felt like sensory seeking was a coping mechanism and a way that they played. And maybe it wasn't like neurotypical sighted children, but I thought, why are we pathologizing that? And why are we trying to extinguish those kind of activities where they're playing in a different way? And of course, now with the autistic population, the neurodivergence, so I'm so happy to see this study and then I'm, I guess integrator reliability is on my mind. So just to verify, for the adolescents and adults in your study, they self-reported on this sensory profile. Am I correct about that?
They all self-reported. They all self-reported. Yeah.
And what a difference that makes. I think it adds validity to your study that is by self-report, because we often, for the younger children, especially our littles, we're using proxy measures, and somebody else, a teacher or a parent, is putting their idea about their sensory responses onto those questionnaires, and I get such divergent responses from the teacher or the parent or from the mom or the dad or the and then the child, and if we can have this self-report, sometimes they don't match. So then I think what how are we going to really get good, reliable, valid data about the sensory reactivity construct? Well,
Interesting.
so there we are. Yeah.
I think it's really interesting to be using now the the self-report with our young adolescents, pre-adolescent, and also getting the information from the parents, using the SPM, which gives that double vision. And I think it's quite, we obviously need to do studies with this, but it's quite nice to see the insight that a lot of those, even, young adolescents have about their own condition. There's usually not, from my experience clinically anyway, there's not that much of a big difference. They're usually pretty good at self-reporting, I think. I was just chatting today with a mom of an adolescent. He's 15. He's actually 18 now, but we've known him since he was 15. And he does have a lot of these sensory seeking behaviors. No, and she's been kind of just keeps bringing that idea back to me. And I keep, trying to see, like, why is he doing this? And this whole discussion about, the underlying factor, that's behind this sensory seeking has just been so useful for her to stop trying to just focus on that sensory seeking behavior. And it's like, okay, when does he do this? And today we had this beautiful conversation and we came to the conclusion, so he does this kind of behavior when he's over aroused or when he's bored. And this is a young man who's very dyspraxic. So he doesn't have a big, repertoire of things that he knows how to do. And he's very hyperreactive to sound and touch. So, okay, so now we're understanding where this is coming from. We're not going to just try to put the lid on the behavior, right? So it's been just lovely to work with Berta on this project and with Dr. Schaaf to try to really put that out there, and hopefully our colleagues feel more comfortable to kind of just put that sensory seeking stuff aside and try to delve into what's behind it.
Yeah, thanks, Isabelle. And just to build on that a little bit, in terms of treatment and make the bridge to treatment, if you misinterpret or I don't know what the word is, misidentify what the behavior is where it's coming from, you will treat it inappropriately. And sensory seeking is the perfect example, because if you just assume that it's a sensory seeking behavior and that it's related to under arousal, then you're going to facilitate. And just from the case that you just presented, Isabelle, that could be detrimental or not a positive outcome. So that's one of the key important points, I think, of this study and the findings.
And also, I think the idea that so often when we hear someone say, oh, this is sensory seeking, it's really pathologizing a behavior that may or may not even be related to some underlying issue, which is something I think we, especially as occupational therapists, we want to understand further. You know, sometimes behaviors are merely preferences. And to call this a problem when we don't really understand if it's, how is it interfering with daily life? Is it interfering with daily life? If so, then what is the explanation for it, rather than just to try to get rid of the behavior? I think this is one of the places that we really diverge from some of the traditional behavioral approaches.
Well, and I think in the typical educational system, I think we tend to believe that our kids in schools need to have more time doing sensory motor activities and being more active with their bodies and learning. And you know, this boy that I evaluated on Monday, mom took him out of the public school system and homeschooled. And he prefers not to have a lot of clothes on when he's working. He prefers to lie on the floor. He has to chew. He has to have his pet turtle. He has to, you know, and there's these conditions for him. And he just is doing magnificently. He's made enormous gains from when I tested him 7 years ago. But the pattern that comes out on the EASI is a vestibular, bilateral, and sequencing pattern with anxiety. And then this over and under responsiveness to touch in different ways. But he's thriving with his mom being able to accommodate those things that help him to feel better. I guess accommodating the sensory seeking, which might be a little bit unusual, but he's doing so well. So yeah, exciting, exciting, exciting.
And we did have some nice studies at our Isaac Congress that actually showed this link, you know, from Dr. Tavasoli and others, where they did actually see this link between the self-regulation and the sensory seeking. No, not as a pattern as such, but really as something to deal with your other real problem, right? And then the other thing that I often tell parents, you know, is now in school and in the society as a whole, we're looking and for, you know, really sedentary, calm, cognitive people, but there has always been your sensory seekers, you know, your more active, outgoing, physical kind of people. But now that might have been like in the past something that was very much appreciated. If you had a farm or, you know, if you're a hunter-gatherer, you want those sensory seekers. You want those people who like, so also just this trait, just this accepting that some people are made to move, you know, I think that also is really something that we have to stop pathologizing.
I agree. Well, have we had a
Do we have any
conversation about how
questions? Do we have any questions from the
others?
audience? Or
I
Think
don't see any
we've
questions from the audience. We had one Q&A
answered.
and Suzanne took care of that. Thank you,
Yeah, a lot
Suzanne.
of good conversation though. So thank you, everyone.
Yeah, good
Yeah, well,
conversation.
I think we continue with our search for data that helps us better understand the reliability and validity of all of our constructs, of all of our assessments. We keep going. I appreciate all your work that you've been doing. There's so much work going on that's just phenomenal. So thank you, everybody here. And yeah, and so wait, Melissa, are you there? I think it's time for well, okay,
Melissa's
because we
getting
have
ready.
more. Oh, she's getting ready. Okay, so she's going to choose our recipients of the drawings, and we do have more awesome work coming up that we're going to present through webinars September 2nd. We have our amazing team in Brazil. They've done, you know, they've collaborated in terms of pool data sharing and different studies. They're going to share that, and then of course we have you know, we have more people coming in the remaining webinars, so you can see those here. So hopefully we'll see you next time. All right. And we do have the classy program, our 6 modules, and so any of you who are interested in having a strong foundation for Ayres Sensory Integration, we do have our certificate program. We'd love to have you here if you know other people who are really interested in diving deep into Ayres Sensory Integration, including the assessments. We're strong on assessment and the data-driven decision-making steps. Thank you to Roseann and Zoe. And yeah, okay, now have the drawing.
Okay.
I want the
And
drawing.
Time.
Get to the drawing.
The exciting ending. Yes, I have our winners for today. So our Southpaw winner is Kevelyn Lindsay. Congrats. And our 3 Intro to ASI course winners are Rachel Koenig, Karen Smith, and Carolyn Moore. So congrats to all of you, and we will reach out via email. Thank you.
Hey, thank you,
Congrats.
Melissa.
Yeah, of course.
Okay, perfect timing. Well, thank you, everyone. And thank you, Suzanne, and to all of our speakers. You're just so wonderful to have you in our ASI family, and thank you for all your contributions.
Yeah, thank you, everybody.
Okay,
All
Thank
right.
you.
good night.
Thank
Get
you
some
all, friends.
sleep.
Have a good night.
Bye.
Good night. Yeah, some of you, it's quite late.
And I think Argentina's going to be up all night, but they'll be ready for you on Sunday, Spain. So
Yeah, I got ready.
Party, 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 party. We want them tired out.
Either way, we party, right? No matter what happens, we party.